How precise are modern allergy diagnostic tests? Imagine trying to find out exactly what makes you sneeze or itch. Modern allergy tests have come a long way, but how accurate are they really? That's what we're here to explore. When you visit an allergist, they use different tests to figure out what's causing your allergy symptoms. The most common ones include skin prick tests, blood tests that measure specific immunoglobulin E antibodies, and sometimes special tests that look at how your cells react. The skin prick test involves tiny pricks on your skin with small amounts of allergens. It's quick and usually very sensitive, often around 90% or higher for common food allergens like cow's milk or cooked eggs. But it can sometimes give false positives or negatives because of skin reactivity or allergen quality. Automated skin prick devices help make results more consistent, but they can be costly and limited in the number of allergens they test. Blood tests, called specific immunoglobulin E blood tests, measure antibodies in your blood that react to allergens. Thanks to improved laboratory techniques, these tests are more reliable than before. They can tell your allergist if you have Ig antibodies to specific foods or environmental allergens. Molecular allergology is a newer approach that tests for Ig antibodies against specific parts of allergens. For example, it can tell if a reaction is due to a true allergy or just cross-reactivity with similar proteins. This helps your allergist make a more precise diagnosis. There are also newer functional tests, like the mast cell activation test and the basophil activation test. These measure how your immune cells react to allergens in the lab. The mast cell activation test has shown sensitivity around 93% and specificity near 96% for food allergies. Despite these advances, the oral food challenge remains the most definitive test. It involves eating small amounts of the suspected allergen under medical supervision to see if a reaction occurs. This test is very accurate but takes time, resources, and carries some risk of severe reactions. Some other tests are not scientifically supported and are not recommended because they don't reliably match what happens in real life. When you see an allergist, they will choose the best tests based on your history and symptoms. Combining these tests with a thorough clinical evaluation helps ensure an accurate diagnosis. This way, you can get the right treatment and manage your allergies more effectively.